Hello, my name is Negin Mehri. Welcome to my presentation. As a former nurse working in a hospital, I came across various difficulties that bedside nurses were experiencing in their professional careers. Consequently, the more I experienced traumatic situations and patient overload, the more I would undergo stress and anxiety. As the pandemic started, our ward, which was a post-surgical ward, was turned into a COVID ward. We all underwent so much stress. We all were working extra hours, experienced stressful situations, and staff shortage that all could be handled better with a good leadership strategies. Issue statement. What is the problem? Nurses are encountering potentially psychological traumatic events, PPTEs, frequently in their workplace. More precisely, nurses describe being exposed to a variety of PPTEs, such as extreme human suffering, illnesses, or injuries that are life-threatening, and physical assaults, and these occurrences routinely take place as part of a daily basis event in their work settings. Additionally, being exposed to chronic PPTEs can increase the risk of mental disorders. And why is this problem important? Countless lives are entrusted to the care and supervision of nurses every time they work. As a matter of fact, nurses have full responsibility for their clients in the healthcare facilities. So it is crucial to maintain a safe and healthy work environment, not only for nurses, but also for the patients. To manage stressful situations and lessen the effects of detrimental stressors in the workplace, nurse leaders can play a crucial role. Human resources are the most crucial component in social systems like healthcare organizations. In addition, leadership significantly impacts results for professionals, patients, and the workplace. According to Marshall et al., the skill to lead others toward desired objectives, whether they are coworkers, friends, clients, or patients, is known as leadership. In addition, a leader is compassionately sensitive to human conditions such as pain, suffering, illness, anxiety, and grief, and on the other hand exercises sound judgment, smart decision-making, knowledge. More specifically, nursing leader promotes health and dignity in a professional and engaging manner. Leaders can decrease or even completely eliminate the impact of controllable stressors such as workload and leadership styles, whereas we cannot completely prevent the impact of other stressors like a pandemic in the future or continuous PPTEs. But what will be different if we make a change? Significant studies show a positive correlation between managers' leadership styles and employee satisfaction, work satisfaction, organizational and nurse dedication, client satisfaction with nursing care, and lower levels of job stress and burnout. The patient experience can be enhanced by the improved leadership approach, flexible career opportunities, and availability of continuing professional development. Review of literature. Nurses are consistently experiencing stressors. Nurses experience a variety of difficulties when working in a hospital setting. According to Stelling and Carleton, 7 out of top 10 sources of stress for nurses were related to the following. A. Work overload, for example, not enough staff to properly support the whole unit and patients, unexpected staffing and working schedules, having to work through break times, and not having enough time to complete all nursing procedures. And B. Issues with their managers and supervisor. For example, lack of support from nursing administrators and being held responsible for things over which one has no control. Although PPTEs will always be an element of the nursing profession, many of the operational and organizational difficulties that nurses have experienced can be improved. According to recent research, emergency room nurses are at a higher level of work stressors. Actually, current research states that in an environment where resources are becoming scarcer and trauma rates are rising, It is crucial to consider emergency room nurses' performance and well-being. Supervisors must be aware of secondary traumatic stress (STS) among emergency room nurses and its effects. STS was defined as stress resulting from helping or wanting to help traumatized or suffering person. They must therefore develop screening instruments and referral process for risky emergency room nurses. Additionally, the nurses in the emergency room cannot give the best care if they are not well physically and mentally. An appropriate style of leadership is beneficial. Sabah et al. Mentioned that the way that nurses view their managers' leadership philosophies has a significant influence on how they feel about themselves. In fact, for healthcare systems to be strengthened and made more efficient, effective leadership is essential. The study tried to assess different leadership approaches of nurse leaders observed by staff and also to explore the relationship between leadership designs and the nurses' quality of life in Lebanese hospital. They collected the data of this cross-sectional study from 270 nurses who were randomly selected from 8 different hospitals. The findings show that compared to the other leadership philosophies, the transformational leadership style of leadership directly increased nurses' level of well-being and the outcome factors, additional effort, perceived leader effectiveness, and satisfaction. When employees consider leader support as a particular habit of transformational leadership style, they have a tendency to have better levels of life satisfaction. According to the mentioned research, a leader's leadership style can have a significant impact on their team members' mental health. By examining the correlation between leadership philosophies and job satisfaction, it is clear that nursing leaders play a crucial role in fostering a productive workplaces that keep and engage and motivated personnel. Nurses' job happiness, organizational commitment, and positive intention to remain in their profession can all be improved by positive and encouraging leadership styles, which can lessen emotional exhaustion. Future recommendations. There are some things that can be done to reduce the effects of stressors or moderate them. Although work stressors will always be an element of the nursing profession, many of the operational and organizational difficulties that nurses have experienced can be improved. What nurses can do? They can prioritize self-care because they usually neglect their own needs while caring for patients. They have to get enough sleep, exercise, and good food. The second one, practice stress management techniques such as meditation and deep breathing exercises. The third one, take break and short time rest during the shifts. What leaders can do? They can implement an appropriate style of leadership, and the second one, seek additional help from other resources. Transformational leadership works in the healthcare environment. Transformational leadership has proven to be a suitable style of leadership. The quality of leaders' relationship with their staff members may be impacted by their transformational leadership style, and by enhancing this relationship, a chance to lessen stress among their employees presents itself. There are evidence for the positive influence of transformational leadership, which leads to a higher levels of job satisfaction and reduced intentions to leave their positions. Project plan to implement transformational leadership. The plan is establishing a clear vision and pathway for the organization, communicating effectively with the people involved, provide training and development opportunities about transformational leadership, creating accountability. Resources. Leadership training programs such as workshops, seminars, courses, effective communication tools such as newsletters, emails, bulletin boards, and social media, mentoring and coaching programs, establishing a feedback mechanism, financial support. Limitations, resistance to change in healthcare workers especially, lack of support from different levels of organizations, resistance from patients or their families. Reflection on TSLSL and leads. The important parts which matters for implementing transformational leadership. Thank you.